Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and at our lab we have done more than 10,000 blood tests for things like acne, fertility and more. Today I'm going to tell you the 10 most important tests which you're missing, which could give you the diagnosis of why your acne is such a big problem. The first and most common cause of acne is having too many male hormones or high male hormones in your blood. They cause the secretions from your pores to thicken, they cause a lot of overgrowth and clogging of these pores, and then they give rise to acne. So let's look at the tests that you can do to measure these hormones. There are 3 androgen blood tests that you can do to check whether you have too high level of these hormones. I've listed them in the slide. These include DHEAS, androstenedione and testosterone. The best test of these 3 is the total testosterone test, and if your value is more than 60, you can definitely doubt that there's something wrong with the level of the male hormones and you can get that treated. The next common problem that causes a lot of acne, especially in women, is having deranged levels of hormones that are involved with your fertility or menstrual cycle. These include hormones like AMH, the LH, the FSH, and a couple of other hormones. And I'm going to tell you which test you can do to find this. So the first is the AMH test, and the AMH is a hormone which gives us an idea of how many viable eggs you have in your ovaries. But if this level is too high, it can definitely provoke an attack of acne. The second one are 2 tests called LH and FSH. Both these tests are involved in the proper growth and release of the egg during each and every one of your menstrual periods. But if the level of LH compared to FSH is very high, this can also cause acne, and the cutoff for this is 2. The last test is called the prolactin test. Now this prolactin is something which is involved in releasing milk when a mother is nursing a child. But if you are not pregnant and your prolactin level is very high, it can definitely provoke an attack of acne. A level of 20 and anything above that could imply that there's something wrong with the prolactin levels. All these 3 are simple blood tests that you can do. The next most common cause of acne, and maybe even more common than everything else, is too much sugar and too much fat. This is probably because of overeating and not exercising enough, and here are some tests that can help you diagnose this problem. A simple fasting blood sugar test can tell you whether your body is not handling sugars properly. A value above 100 if you are fasting is definitely a sign there's something wrong with the way your body is handling sugar, and this can cause acne. The next is a test called insulin resistance, which also needs a blood sample to be taken when you're fasting. This will measure your fasting sugar and your fasting insulin, and a value more than 2.5 is definitely a sign that your body is not being able to maintain the correct level of sugar, and this is probably causing your acne. The last one is something that is to do with your cholesterol levels. We know that there is something called HDL or good cholesterol, and if the good cholesterol level falls below 40, especially if you're a woman, this can definitely cause something called metabolic syndrome, and that can lead to acne. All these 3 are simple blood tests that you can do. All you need to do is you have to be fasting for 8 to 12 hours in the morning, and then you give your blood sample. The last very common cause of acne is people who have some kind of a disease in their thyroid. The thyroid is a gland which is present here in the neck, and if there is any inflammation or swelling in the thyroid, it can derange the way your body's metabolism function and can cause acne outbreaks. I'm going to give you some tests that you can do, some blood tests to check if your thyroid is working properly or not. So to check your thyroid and whether it is inflamed, you can do 2 blood tests called the anti-TG and the anti-TPO test. Now these are antibody tests, and if their values are positive, it could imply that you have some kind of an inflammation or swelling in your thyroid gland because your body is attacking the thyroid gland. The last is the FT4 and the TSH test. These 2 are simple blood tests which will measure the actual thyroid hormones, and if your FT4 is low or your TSH is too high, both these things will tell you there's something wrong with your thyroid, and if associated with your acne, this could be the real reason why you have so much of acne. So you can also do these 3 simple blood tests to check your thyroid.